Good afternoon, everybody. It is 4:30 on Tuesday, so a day later and 30 minutes after our normal start time for our COVID update. Today, we have passed more than 1 million cases of COVID-19 since the inception of the pandemic in Kentucky on March 6th of 2020. As of today, we've had 1,014,703 cases. And we're coming off the highest week by far of new cases, and I believe probably the highest 5 days. The past 5 days, I'll read them out, 53,504 new cases. So if we go back to last Friday, where it starts, this report, 13,492 cases, 35 new deaths, including a 28-year-old man from Callaway County, a 46-year-old man from Knox County, and a 31-year-old woman from Pulaski County. That ought to encourage people in that age group to get vaccinated. The 15th, that was Saturday, our highest day ever, 14,896 new cases, 39 new deaths, including a 30-year-old man from Barron County and a 35-year-old man from Taylor County. 16th of January, 9,730 new cases, 23 new deaths, including a 40-year-old woman from Hardin County, 44-year-old man from LaRue, and a 49-year-old man from Nelson. 17th of January, 6,644 new cases, 18 new deaths, including a 40-year-old woman from Pulaski County. And then today, and remember with the weekend that we had, we're less testing. So we expect these numbers to increase this week. 8,742 new cases, 16 new deaths. Today's a tough one for people in their 40s. 47-year-old woman from Adair, 49-year-old man from Callaway, 45-year-old man from Campbell, 41-year-old man from Grayson, 41-year-old man from Jefferson. So if you are in your 40s, this thing is killing you right now. Please get vaccinated. As of today, 2,200 Kentuckians in the hospital with COVID, 431 in the ICU fighting COVID, 244 currently on a ventilator. And today we've reached an all-time high in positivity rate at 30.25%. We never dreamed that almost 1 out of every 3 people being tested would be testing positive. So the stair stepper chart is going to take your breath away. The chart, as we showed it last week, was incredible in how much higher 2 weeks ago was than any other week on record. But as this chart shows you, the increase is significant, severe. 72,165 cases in 1 week, by far more than any other surge that we have had. That is more than double the records that we had during the Delta surge. I will say we expect this week to probably be more than that, though I do not know that we will see the same level of growth week over week as we have seen in those past 2 weeks. If we look at the positivity rate, again, so much higher than at any point during the pandemic. Now the growth in positivity week over week is less than when we look at cases. So right now, this is certainly the most contagious COVID has been by far. While it does appear that Omicron, especially if you're vaccinated, is less likely to make you seriously ill than Delta, and it is less likely to cause death than Delta, the number of people that it's impacting, that it is infecting, is pushing our hospitalization to near what we had in Delta. Let's look at that line graph. So Delta overran our hospitals. We had to call in the National Guard, which we have done here. Look at how significant that increase is, and look at how close we are getting to our all-time high in hospitalizations. We do not want that to happen, and it's pretty simple. Get vaccinated, get boosted, and you're very unlikely to end up in the hospital for Omicron. When you look at, go back to Alpha, which is the first surge that we had, we didn't have vaccines for the most part at that point. That's when you saw the big drop off. We didn't have the tools to protect ourselves and each other. When Delta hit, it was tough. It was really tough. But Delta would make you sicker than Omicron. And yes, you can get vaccinated and you might still get Omicron when maybe you would not have gotten Delta, but the odds of you being in the hospital if you are vaccinated are so much less. So get your vaccine, get your booster. If we look at ICU, also trend upwards, not quite as significant as the hospitalizations. There's that small downturn. That's what we always get coming off the weekends. So that is still an upward trajectory, but certainly the hospitalizations increasing a lot faster than the ICUs and the ventilators, and the growth in ICU and ventilators, even with the large amount of cases, doesn't appear to be as severe as Delta, though again, if we have even more people get infected this week, that could change. Hospital capacity across the state is stretched. We have some hospitals that are using crisis standards, which allow them to have some latitude in when they bring staff back to work. We have all but one region in the red, and you look at Region 4, ICU beds, 97.6% full. Region 10, 98% full. That's certainly concerning. Vaccinations over the weekend, not as many as we sometimes see, but 7,204 Kentuckians got vaccinated for the first time. 4,458 Kentuckians got their second dose to become fully vaccinated, and 16,122 Kentuckians got their booster. Total vaccinations, if we look through it by age, there is one very exciting increase. Total Kentuckians the total number of Kentuckians vaccinated, 2,824,262. But 18 and up, those that make their own health decisions, went up a 0.275%. I personally think that's a pretty big deal. 3/4 of everyone in Kentucky that can make their own healthcare decisions have decided to get vaccinated. That is an overwhelming majority of people making that decision. And that ought to tell everybody else looking at it that, hey, 75% of people thought this was a good idea. Maybe I should think a little bit harder on it. The other age groups that increased, 25 to 39 went up a point to 62%, and 5 to 11 went up a point to 19%. But the 5 to 11 area, we have to do better. All the schools that are on NTI and others where we want our kids back in school, we certainly need to get more of them vaccinated, because that is less virus that is circulating in those buildings. Just a couple things, and I don't think we have a slide. We haven't broken down cases, deaths, and vaccines by race in a while. On cases, when we look at our Black and African American Kentuckians, remember at one point cases and deaths were really out of whack with the population makeup. Now they are at or below it, with cases being about 8%, right on the population line, deaths being 7% below the makeup of the population. I think that shows that when we are intentional, when there's outreach from so many people, that turned around those statistics, those health outcomes from July of 2020, when they were so concerning, in a very positive way. As of today, Black and African-American Kentuckians make up 7% of the total number of vaccinations, though the other category is still at 10.3%. So it is probably a little bit better than the 7% that is there. Vaccination status of cases, hospitalizations, and deaths. What you'll see on here is cases. Now 79.7% of all cases are unvaccinated individuals. This is two things. It's waning immunity, right? Not getting your booster. And it's that Omicron is more effective at getting past the vaccines. But then look, go down to hospitalizations. Even with waning immunity, 85% of everybody in the hospital for COVID is unvaccinated, and 83.2% of all deaths. So getting a vaccine, if we'll put it up, and it's just the rate of cases, much less death or hospitalization, still 3.6 times better to be vaccinated just from the standpoint of getting COVID versus not getting COVID. And that is close to the level of protection at any other time in this pandemic. So what it says is get vaccinated. And let me just mention again, the way that all the anecdotal evidence and everything we're seeing in the numbers comes in on your level of vaccination is pretty close to determining almost exactly how sick you get if you get Omicron. If you are vaccinated and boosted, most people don't even have a symptom or feel like they have a cold. If you are vaccinated but have put off your booster, it's hit people, maybe like the flu, it's gotten some sick, but all in all, most of those folks are able to stay out of the hospital. If you are unvaccinated, it hits you like a Mack truck. And we see people in the hospital and dying from Omicron because of that failure to get vaccinated. When they talk about how many people have now gotten infected in COVID, they're saying they can show 20% of the U.S., but the national experts say it might be 4 times higher than that. What it said is we may all get COVID at some point before this is done. Well, that ought to make you really want to be as protected as you can be from it and to keep up that level of protection. The tools are out there. Just get vaccinated. All right, we have an update in COVID and corrections facilities. It was at a low level last week. It's done what Omicron does. Now we have 294 corrections staff that are COVID positive and 392 active inmates. 3 institutions are on quarantine: Eastern Kentucky Correctional Complex, Kentucky State Reformatory, and the Kentucky Correctional Institution for Women. But no inmates have been hospitalized due to COVID-19 during Omicron. And I'm really proud of this, and I'm proud of corrections. You know what? I'm proud of those incarcerated individuals for their choices. 85% of inmates have been vaccinated, and 55% have gotten a booster. That booster level is better than our overall population. And think about that. Even in a place that is that big of a congregate setting where it can spread, at the moment, not one incarcerated individual has had to go to the hospital. So the safety of everybody, staff, inmates, and others is so critical, and it's hitting the staff harder than the inmates, in part because the inmates have such a higher vaccination rate than the corrections officers themselves. We have a couple of dorms within the other prisons that are also on quarantine, but our ability now is even better than early on in the pandemic. So early on in the pandemic, you'd have to PCR everybody and it would take multiple days, and we were trying to move people in different parts of the prison. Now we can do it in a much smaller area using rapid tests. And the sophistication on how to be able to deal with a breakout of COVID in our prisons has gotten a lot better. So we will continue to keep everyone informed. Also, a veteran is tested positive for COVID-19 at Eastern Kentucky Veterans Center and at Radcliffe Veterans Center. So at the moment, we have 2 positives at Thompson Hood, 5 at Western Kentucky Veterans Center, 1 at Eastern Kentucky Veterans Center, and 1 at Radcliffe Veterans Center. With that, I'm going to turn it over to Dr. Stack for his update, and then I've got just a couple of other pieces when he is done, and we'll open it up for questions.
Thank you, Governor. Good afternoon, Kentucky. So as Governor Beshear has already shared, we set a new weekly record last week with 72,165 new reported COVID-19 cases, which is a 37% increase over the prior week. We've set other records too. Over the last 30 days, the number of weekly COVID-19 tests reported to the Kentucky Department for Public Health has risen from about 101,600 all the way up to 190,000 over a 7-day period. That's a remarkable 87% increase over the past month. Even so, the positivity rate is over 30%, as the governor has shared today. The good news is it's blunted maybe the rate of rise a little bit, so testing has caught up in some measure. But clearly, Omicron is unlike any prior chapter in this pandemic. Hospitals are struggling, and some have even declared crisis standards for staffing in order to bring back staff from quarantine or isolation earlier in order to help provide care for people who are hospitalized. More than 450 National Guard women and men are currently supporting the COVID-19 response in healthcare facilities. It's a tough time to work in a hospital. And I'd like to thank all of our healthcare professionals who keep showing up to help others, even under these horrible circumstances. There could, though, be some light ahead. And if we could put up the first slide, please. Like I did last week, I'll start with a slide taken from the 91-divoc.com website this morning. For comparison, I show here Rhode Island, which has had the highest recent Omicron peak in the nation, and also New York. These states are probably about 1.5 to 3 weeks ahead of where Kentucky is in the Omicron surge. Both Rhode Island and New York are showing a rapid decline in new cases that appears to mirror the immediately prior vertical climb. If Kentucky follows this pattern, then we may see our own peak within the next 1 to 2 weeks, and this, of course, would be a very welcome reprieve. Until then, I again urge all Kentuckians, please don't go to an ER just to get a COVID test. Roughly 28% of all of the people going to an emergency department today are going for COVID-19. Now, some of these people need emergency care and they should be there, but others only have mild illness, and this is overwhelming the emergency care system and making the situation worse. If you can't get a test but have mild to moderate illness, please stay at home until you feel better. If you need medical care and are not terribly sick, please call your doctor or your primary care provider and ask for their guidance. And only go to the emergency department if you feel you have an emergency. But if you have an emergency, please go there and they'll be there to take care of you. Now, a few words on testing. If we could put up the second slide, please. President Biden's plan to make 1 billion at-home tests directly available to the public launches tomorrow. The Biden administration has informed the public that you may order 4 at-home COVID-19 tests per household at covidtests.gov. So it's covidtests.gov, and it's up in the top left there, starting tomorrow, January 19th. Now, I looked at the site this afternoon, and they're doing some kind of beta launch, and so you could already place orders. So if you want to take a look, you can go there today and see if you have some good fortune. They say shipping of these should come by United States Postal Service later this month. Additionally, the president has communicated that private health insurers will now be required to pay for up to 8 at-home tests per insured person per month. The details of this program are still evolving, so please stay tuned on that. As 2022 unfolds, though, very clearly, more abundant availability and use of at-home tests with more precise isolation of people who test positive should enable us to further engage in school, work, and leisure activities with more safety and less disruption. So that's the future, is more of these at-home tests where you can take responsibility at home and make sure you stay away from others when you're actively contagious. Now, finally, I'll touch on monoclonal antibodies and oral antiviral medications. If we could put the last slide, please. As we've mentioned, we've hit stratospheric new heights for the number of new cases per week. At the same time, Omicron rendered useless 2 of the 3 FDA-authorized monoclonal antibodies, REGEN-COV and BAM-ETE. Those 2 medications appear to have absolutely no value or impact on the Omicron variant. The result is a massive shortfall in monoclonal antibodies available to treat people who test positive for COVID-19. Now, in this table, you'll see the data for both Kentucky and the United States overall. I'm only going to focus on Kentucky because the story is pretty much the same for the nation as a whole. There were more than 72,000 new COVID-19 cases in Kentucky last week. In comparison, the amount of sotrovimab, which is the single effective monoclonal antibody available, is scant. Its supply is scant. In Kentucky, we are receiving enough sotrovimab this week, 546 courses, to treat roughly 0.75% of all the known positive cases. Functionally, effective monoclonal antibody therapy is unavailable except for a rare few people. The same is true, actually very nearly identically true, for the most effective oral antiviral medication, Paxlovid. We had almost identical quantities on a weekly basis of Paxlovid as we did for sotrovimab, which means that about 1.5% of all of the new cases last week theoretically could have had access to those medications. So folks, between these 2 medications, there is not enough supply for you to rely on having access to them, no matter how we try to distribute it. And this doesn't even account for the many more persons we know have used at-home tests and not gone to a medical facility for a test, or who have just stayed home and not tested at all. The bottom line is that you can't rely on finding these medications reliably, no matter how we distribute them. And this won't change before the Omicron surge recedes. So the production and the quality or quantity of these medications is not likely to markedly increase until we get past February and into the early spring. Vaccines, though, remain abundant and highly effective in preventing severe and life-threatening disease. Getting vaccinated and staying up to date with your booster is the safe and effective way to protect yourselves and your loved ones. More than 1,700 vaccination sites are enrolled in Kentucky. To find a location near you, go to KY COVID-19 or vaccines.gov to search by zip code for a convenient location near you. You can take them. There we go. We're already ahead of me. So the rest of the guidance as I wrap up here should be familiar to everyone. If you are sick, stay home until you feel better. Get vaccinated or boosted if eligible. Wear a well-fitting mask at all times when indoors in public places such as school, work, stores, etc. If you think you have COVID-19, please get tested. We're all fed up with COVID-19 and ready to put this pandemic in the past. Though it feels like an eternity, we have made good progress. For people under 60, vaccination makes COVID-19 related death a largely preventable outcome incurred nearly only by the unvaccinated. Even for people over 60, roughly 3 out of every 4 COVID-19 deaths are in unvaccinated persons. More abundant testing, better access to PPE, and a lower proportion of hospitalized people due to vaccination and a less virulent Omicron variant have all made the current surge less horrific, even though difficult, than it would otherwise have been. Thankfully, 2022 offers real hope that society will transition to a more agreeable normal in which we safely enjoy more of what we missed from 2019 and before. Until then, please be kind and caring towards each other as we face this challenge together. Thank you very much, Governor.
I had 3 non-COVID pieces. First, on Friday, Brittany and I were honored to welcome the First Lady of the United States, Dr. Jill Biden, to Bowling Green. Dr. Biden visited to see firsthand the challenges that so many Kentuckians are facing in the aftermath of the worst tornado disasters that we have ever seen. Together, we joined Representative Brett Guthrie, FEMA Deputy Administrator Eric Hooks, and other leaders to first visit the Creekwood neighborhood, one of the neighborhoods in Bowling Green that was hit the hardest, followed by a visit to the area's FEMA Recovery Center. This center filled with amazing volunteers, including my new friend Maddox, just 6 years old, but wanting to come out and help people, has helped more than 900 Kentuckians with financial, emotional support and help. This was an incredibly special day for the people of Kentucky. We've seen that the whole world's trying to help, and certainly visits by the President and the First Lady being here to support us in our time of need are greatly appreciated. I'm incredibly grateful to Dr. Biden for her time and the compassion that she showed to everyone that we saw, from those that were impacted to those that are helping. We will not only dig out, but we will rebuild in each of these communities, every building, every life. Team Kentucky appreciates the President and the First Lady's support in it. Our Team Western Kentucky Tornado Relief Fund now up to just under $42 million donated. We have now provided payments for every single individual that lost their lives for funeral expenses. We've announced that we'll be providing 10% on top of FEMA awards to uninsured homeowners, and today we can extend that to uninsured renters. For those that want to know how to get help from the fund, you need to apply for FEMA. That's what gives us the necessary information and verifies that you were impacted by the storm, and gives us an idea of how much. By adding on top of FEMA for expenses that FEMA is not covering, which is the language we have to use, we can assure that every single person who receives help from this fund was one that was truly impacted. So make sure you apply for FEMA. So right now it's been funeral expenses, 10% on top of the FEMA award for uninsured homeowners and uninsured renters. And my hope is that here very shortly we'll be able to expand that to a 10% add-on to every FEMA award, even for those that are insured. I believe the fund is going to allow us to do that, but we are being careful because there are a lot of organizations that we're really grateful to that are on the ground now, but will lessen that support over time. The goal here is especially, month 6 to month 24, being there to provide the necessary support. When we look back on whether it was Hurricane Sandy or Boston Marathon or others, and how we manage these funds, each and every one talks about how so much help flows in the very beginning and how much that help is needed in the aftermath. And this one will have a much longer time horizon than just about any disaster we've seen nationwide, and how long it'll take to rebuild. We are grateful for all of those donations. Every single bit are going to go to help these families, and every single family that gets these dollars will have been verified through FEMA that they did sustain harm. All right. I hate to provide another weather update, but rain will begin Wednesday morning and transition to snow and or wintry mix Wednesday night behind a cold front. Temperatures will crash from the 40s Wednesday afternoon into the 20s by early Thursday morning. Still some uncertainty in where the corridor of winter weather will occur and will impact, but expect for roads to become icy and snow-covered Wednesday night as rain transitions to snow and or a wintry mix, and Thursday morning could be really treacherous on the road. So be prepared. I would say be prepared if necessary. If you don't have a job that you have to be in, to potentially work from home that morning, or give yourself a whole lot of time. And my goodness, if you are a tractor trailer, why don't you stay off the road during that period of time so we don't have some of these large accidents that have closed multiple interstates. Watch the weather if you're driving something that big. You got a responsibility to others on the road. Final piece, going back to the tornadoes. February 11th is the deadline to apply for FEMA assistance. So that's an important one. And as a last piece, COVID delayed a lot of things, including the current First Lady of Kentucky's doll on display here at the Capitol. This is a longstanding tradition where every single First Lady of Kentucky has a doll made for them with a representative of the dress worn at the inauguration. Brittany had to wait about a year plus, longer than it normally takes, but they did an incredible job. I think the only thing missing is Winnie right next to her. So we'll open it up for questions. We got 2 journalists here with us and more on the line virtually. We'll start with Karen Czar.
One is with the National Guard, are they fairly evenly distributed through the state? Are there some areas that need more and more capacity? And then the other is, we're hearing reports of a lot of people are hospitalized who are testing positive for COVID, but that's not why they are hospitalized. Are we breaking that out at this point, or is it all in one lump?
So it's all in one lump. Our hospitalization numbers include those that go in because they're feeling really sick, or those that are in for other things that test positive for COVID. That's still somebody that is taking up a bed that can infect the hospital staff and impacts the overall hospital capacity. You know, I know certain places are breaking it out, but our fear on hospitalization isn't just COVID, right? It's not having enough staff for the person hurt in the accident. And what was the first one again?
National Guard.
Yes, National Guard is deployed all over the state, about 440 to 445. They're in almost 30, I think, hospitals and some nursing home facilities. And some of our psychiatric hospitals as well. You know, typically it's 5 to 15 guardsmen or women that are in any facility. So all over, and we worked with each institution, each hospital system to get it right. In fact, some were gracious enough to say, we've got it for now, but we may need help later. Mike Valenti.
I have a 2-part question as well. Would you advise Kentuckians who are older or immunocompromised to start talking to their doctors about a potential 4th booster shot? And also somewhat related to COVID, as you know, there's a current blood shortage crisis the Red Cross has declared, which has renewed calls for the FDA to lift all restrictions on the ability of gay men to donate blood. There is no longer an outright ban, but there are still restrictions. Where do you stand on that? Do you think the FDA should remove all restrictions?
Well, this is the first that I've heard about FDA potentially lifting restrictions. I'd like to think that there are enough ways to test blood to where we wouldn't have blanket restrictions based on someone's sexuality and in giving blood. I'd like to think that there's an ability, if somebody wants to help, to do what's necessary to screen blood. Second piece was the boosters. I think right now the boosters are so recent that they ought to provide the level of protection that's needed. And until the FDA or the CDC starts talking about 4th booster, I think it's premature. In the data that we're seeing, people who are vaccinated and boosted, even seniors, are holding out pretty well against Omicron. Tom Latek, Kentucky Today.
All right, couldn't get the unmute button to work just right there. Can you hear me now?
I can hear you.
All right, good. I noticed today that you signed both the Supreme Court redistricting bill and the bill that provides how a court challenge to redistricting would work. What is the status of the other 3 redistricting bills? Do you plan on signing them, vetoing them, or let them become law without your signature?
I'm still reviewing the other redistricting bills. No decision has been made. Debbie Yetter, Courier-Journal.
Okay.
Hi, Governor. You mentioned a couple of cases at 2 of the veterans' homes. I wondered overall how the state nursing facilities are faring long-term care during the Omicron outbreak, and whether you're seeing a resulting spike in cases there as well.
So our state facilities have not received reports of significant outbreaks. We're obviously concerned about any of our facilities, and certainly the prisons went from just a handful of cases to hundreds of cases. So right now I have not received, and I don't think Dr. Stack has received, a concerning report, but we will check on it to make sure and get back to you if we are seeing anything of concern there. Now, it can grow real quickly, but what we look for, and we all know this by now, is you can look at number of cases, but also how sick they're making people. Certainly right now, while we don't like several hundred cases in our incarcerated Kentuckians and even more in our corrections officers, but nobody having to go to the hospital is a big deal. April Rickard from WFPL.
Thank you very much. This is about hospitals. Which hospitals have declared the crisis level for staffing and what's the protocol for return if they have to?
I don't have the specific hospitals that have done crisis standards.
Let us know, but others just declare it.
Right. So it doesn't actually go through us in order for them to do that. But do we have a list of ones we know?
I know a handful that we can get.
Okay. We'll get you the ones that we are knowledgeable about. We'll prepare that with Dr. Stack's group. Corinne Boyer from WEKU.
Hi, Governor. Is there a minimum number of symptoms someone with COVID in a prison needs to have in order to be hospitalized? Would a prison deny someone a hospitalization if they didn't seem sick enough?
Well, certainly most of the hospitals have some form of medical staff that is there, either contracted or always in the building. Now, I believe that we've worked with our hospitals to make sure that those prisoners that need care are being provided care. In this instance, the level of vaccinations by those incarcerated is great. I mean, 85% is an incredible number, which should keep people from getting sick or significantly sick. And then 55% fully boosted. But typically they would see somebody within the institution itself that would use some form of judgment. But somebody sick enough to be hospitalized, I think is going to be hospitalized. If there are concerns that that's not happening, that's something we'd certainly take a look at. Melissa Patrick, Kentucky Health News.
Hi, Governor. Can you speak about the Supreme Court deciding that healthcare facilities getting federal money can require workers to get vaccinated? And do you have a number of what percentage of healthcare workers have been vaccinated?
Percentage of healthcare workers in the types of facilities that receive federal money. What percentage of them have been vaccinated? So the Supreme Court, made two decisions. One, it overturned the large employer mandate, but at the same time, it allowed that mandate for those healthcare facilities that receive federal money to move forwards. Obviously, people in healthcare facilities need to be vaccinated more than just about any other profession. They need to be vaccinated. And I've mentioned before, I have concerns about healthcare workers that won't get vaccinated and what type of advice they might be giving to people who desperately need to get vaccinated. So I anticipate that just like hospitals that have required vaccinations, there will be very little. There will be very few people who ultimately refuse, that won't have as significant of an impact on the workforce as some would like you to believe. It seems like most facilities end up hitting about 1%, maybe a little bit more than 1%, but are able to hire and fill back in for those individuals. And finally, Austin Horn from the Lexington Herald Leader.
Thank you, Governor. I'm wondering, since you've had some time to consider the redistricting maps passed by the Republicans, if you have any comment on how fair they are.
Well, I signed the Supreme Court redistricting map, so ultimately believed that to be fair. I am still reviewing and analyzing the other maps. No decision has been made, so I haven't come to a final conclusion on constitutionality or fairness, but I will by 11:59 on Thursday, if not before. All right. Thank you, everybody. Get vaccinated, get boosted, wear your mask. It is the most COVID since March 6th of 2020 all around us. Please take care of yourself. And remember, if you're vaccinated and boosted, you're going to be okay. You're not likely to get all that sick. And if you wear a mask on top of that, you may not get it at all. Thanks. Much less poetic than